thank you all for being here. I've heard a couple of you speak before. This is really interesting stuff. And I'll start with you, Dr. Schlossler, since you're from Tennessee or HCA. Let's talk about the pharmaceutical supply chain, and it can be very difficult and complex to trace. And as a pharmacist, I'm responsible for knowing every step in that process in the supply chain, from the manufacturer to the dispensing of the drug because of the pedigree. How can AI be used to help pharmacists in their role optimizing medication use and patient health outcomes, improve providing patient care? How can we use that, and hopefully we can be reimbursed for that?
Yeah, well, thank you, Congresswoman, for the question. And I think there's tremendous opportunity. We actually already use varieties of artificial intelligence in our pharmacy processes, and we've actually done this for years. We have heuristic models, which are basically rules-based models that are constantly surveilling patient charts, looking for opportunities that can serve up to the pharmacist, be they drug interactions or substitutions or places where we can be more efficient or provide more effective treatment. And so I think those models are only going to improve and get better with the advent of these more advanced artificial intelligent algorithms. I think the same is true for our pharmacy supply chains, and we've mentioned this already today, but the ability to get predictive in understanding the demands and needs of our patients on a hospital or even unit basis, and then be able to go back upstream and ensure that we have the adequate supply to meet those demands. And if we don't, can we make kind of preemptive steps to ensure that we can maintain adequate supplies is another area that we're already working on, and I think there'll be great benefit.
Very good. You've already told us about how HCA, the hospital system, sees value in the adoption of AI technologies without even additional payment in that. And you've talked to us about removing the administrative burden and its reduction of time spent that does not involve direct patient care. So this is my question, and this is your chance to tell me what to do. What recommendations do you have for this committee in creating payment models in AI for healthcare services, application, and add-ons?
Yeah, and some of my panelists have had a chance to weigh on this already today. I do think as this technology advances and it becomes more a meaningful and central part of healthcare delivery, that CMS is going to have to find an approach to reimburse for this technology. And in my personal opinion, it's not that different than the initial approaches they tried to take around chronic disease management of how do you reimburse for sort of the ongoing work that in this case an algorithm would do to help prevent complications, to help reduce cost. The last comment I would want to make here is that I think we have a great opportunity with AI, since we're at the beginning, is to take a business case minded approach to how we deploy this technology and not have it just be another technology that we deploy that adds more cost, and then we try to add more reimbursement and therefore drive up the cost of the healthcare system, but instead be really thoughtful about how can these technologies make us more efficient and more effective and decrease the overall cost of the healthcare system as we deploy them.
Well, we're going to have to. So you will continue to exist. Dr. Longhurst, how do you think AI and medical liability intersect?
Fantastic question. Thank you. As was previously mentioned on this, AI is a tool, whether it's being used for diagnosis or treatment options or others. Ultimately, the liability for treatment of the patient rests with the treating physician. Yeah. And so we've had perhaps not AI tools for a long time, but we've certainly had clinical decision support tools for a long time that suggest potential drug-drug interactions or dose range errors and other things. And the liability has always rested with the treating clinician to see these alerts, manage them, but make the best decision for the patient. So I think the real question about liability in AI comes if you take the human out of the loop. Right. If there is a step that's taken towards making diagnoses without clinicians, then it begs all sorts of other questions about licensing these tools.
Yeah, exactly. Do you see a scenario where litigation might increase if doctors don't utilize AI?
That is a fantastic question as well. In fact, a recent Boston Globe survey of patients asked, would you see a doctor that was not using AI? And the predominant answer from patients was, I would be concerned if my doctor was not using the latest tools. Okay. So I think, as was recently described by Dr. Newman-Toker, if these tools are shown to be best practice, if they can decrease mortality, if they can increase survivorship, then they will become a best practice that should be used in every case.
Okay, thank you, sir. And I think I'm out of time, so I yield back.
Thank you. The